Okay, folks, before we get into the coronary circulation, let's just do a quick review of this image. Um, we know where the atria are, right atrium, left atrium. The ventricles, you'll notice, are separated by a groove. This groove here, and a lot of the grooves on the surface of the heart are filled with some adipose tissue. That adipose tissue is there to protect these blood vessels, which are part of the coronary circulation. But this groove right here also separates the two ventricles. It's known as the interventricular sulcus. And since this is the groove in the front, it's known as the anterior interventricular sulcus. So interventricular means in between ventricles, and a sulcus is a groove. So on this side of the groove is the left ventricle. On this side of the groove is the right ventricle. There's also a groove that separates the atria from the ventricles. That's often called the coronary sulcus, or in some cases the atrioventricular sulcus, because it's between the atrium and the ventricle. Okay, so you can look at this. We've covered pretty much everything, but what we're going to get into in this video is the coronary circulation. So coronary circulation is how the heart pumps blood to itself. Okay, so we're not going to use the blood from directly out of the chambers to supply the heart. We're going to tap into the aorta. So the coronary arteries are in essence your first systemic arteries off the aorta. So if this is the aorta, we call this the ascending aorta. This is the arch of the aorta. Right immediately off that ascending aorta, there's two coronary arteries. This one here is the right coronary artery because it comes off the right side of the aorta. And then the left coronary artery would come off the left side here of the aorta. You can't see it because it's behind the pulmonary trunk, but then you'll notice it kind of pops out right here and branches into two arteries. So you've got a right coronary artery, you've got a left coronary artery. Each of those arteries have some branches. Those arteries eventually lead to little arterioles and little capillaries. The capillaries are all throughout the heart muscle, delivering oxygen, nutrients, picking up carbon dioxide and waste. And then the coronary veins need to eventually bring that blood, because now it's deoxygenated, back into the right atrium. Okay, and we'll talk more about this coronary circulation in a few moments. This is the back of the heart, so we want to know what the back of the heart looks like as well as the front of the heart. And you'll notice when we're looking in the back, this side is going to be the right, this side is going to be the left. So we've got the right atrium, the left atrium. We've got the right ventricle and the left ventricle. We see the vena cava, superior, inferior vena cava, bringing blood into the right atrium. We see the pulmonary veins, bringing that oxygenated blood into the left atrium. We see the pulmonary trunk splitting into pulmonary arteries, delivering blood to the lungs to get oxygenated. And then we see the aorta delivering oxygenated blood throughout the body. In the back of the heart, we also see a groove that separates the ventricles. So this groove here would be the posterior interventricular sulcus, and it has some coronary arteries and veins in that groove as well. So there's really three major pictures to look at. The first picture, where we can look inside the chambers, that would be that frontal or coronal plane through the heart. We have the anterior view, and then now the posterior view. Okay, so this slide specifically talks about the arteries of your coronary circulation. And this does a little bit better job of showing you where those arteries come off the aorta. So you'll notice here's the aorta. They show the aortic valve. So just above the aortic valve are the two coronary arteries. Here's the left coronary artery, kind of hidden behind the pulmonary trunk. And then right about here is where it divides into two branches. One of its branches is known as the circumflex branch. It kind of goes around the circumference, and then towards the back of the heart. And then the other branch comes down the front in between the two ventricles. And that was the branch that's in that sulcus that has the same name. So it's the anterior interventricular branch, which is located in the anterior interventricular sulcus. The right coronary artery has two major branches as well. If we follow this right coronary artery, this is where we kind of think of it as a major split. It has what's called the marginal branch, which comes down this right side of the heart. A margin is kind of the side. And then this other branch wraps around to the back and goes down in between the ventricles, where it's known as the posterior interventricular branch. So you'll notice this is kind of the scheme of blood flow of your coronary arteries. They come off the ascending aorta, right and left. The left has two major branches, anterior interventricular branch and circumflex. And then the right coronary artery has two major branches, posterior interventricular branch and marginal branch. And then down here it just kind of shows you, what part of the heart is getting blood from these branches. One little note is that this artery here, the anterior interventricular branch, since it delivers a lot of the blood to both the left and the right ventricle, it's called the widowmaker. Because if it gets blocked, all right, so these arteries are what cause heart attacks. If there's any blockage in blood flow due to blood clots, or if there's any reduction in blood flow due to atherosclerosis, and these arteries are not delivering enough blood, that causes a heart attack. And this one's called the widowmaker because if it gets blocked, you lose a lot of blood flow to that left ventricle, and you can't really live for very long without getting adequate blood flow to your left ventricle. So those are the coronary arteries. Again, what is the purpose? It's to deliver oxygenated blood from the aorta to the myocardium. Then once it delivers that blood, right, delivers the oxygen, delivers nutrients, picks up carbon dioxide and waste, it needs to bring that blood back into the right atrium. Remember, the right atrium is what receives deoxygenated blood. So these are some of the larger coronary veins. So there's one in the front called the great cardiac vein. This one here is called the small cardiac vein. But I really want you to know the coronary sinus. So the coronary sinus is where all the coronary veins eventually deliver the blood to coronary sinus, which is on the back of the heart. And then that coronary sinus brings it into the right atrium. All right. So remember, we first started out by learning that the right atrium gets blood from three vessels: superior vena cava, inferior vena cava, and coronary sinus. Continuing with this topic, once we understand what the coronary circulation is, we can better understand what a heart attack is. Heart attacks are often caused by coronary artery obstruction. That obstruction causes a blockage in blood flow to that part of the heart. When a blockage of blood flow is called ischemia. So it's a temporary deficiency in blood flow to an organ. In this case, it's myocardial ischemia because it's blockage in blood flow to the heart muscle. This could be due to reduction in blood flow, atherosclerosis. This is when there's cholesterol and saturated fat reducing the diameter of the artery. Could be caused by blood clots or other rare causes. Ischemia is going to cause a reduction in oxygen, so hypoxia. When heart muscle isn't getting enough oxygen, it weakens the muscle, and then it could potentially cause the muscle to die. You often get a sign from a heart attack. Not always. Minor heart attacks, you often don't have chest pain, pretty severe heart attacks, you get angina pectoris, which is chest pain. So obviously the goal would be to restore blood flow. And the restoration of blood flow is called reperfusion. All right. And that sounds great. And that's something you want to do, is to restore blood flow. That can be done either by dissolving the blood clot, if it's a blood clot that's causing it. We call those thrombolytics or clot busters. We can open up that coronary artery by using a balloon angioplasty, which is a little balloon catheter that inflates and kind of squeezes open the artery. And then quite often they'll leave behind a stent, which keeps that artery open. In severe cases, they can do what's called a bypass, a coronary artery bypass. If the restoration of blood flow wasn't timely enough, and the reduction of blood flow occurred for a certain length of time, that can cause a heart attack or a myocardial infarction. Heart attack is the loss of living heart muscle, so the muscle dies due to a prolonged or severe ischemia. When heart muscle dies, it actually gets replaced by scar tissue, and the scar tissue has two problems. Number one, it's not muscle. Number two, it doesn't transmit the electrical activity through the heart, and we'll talk more about that when we get to physiology. All right, let's take a look at some of these treatments. So this is kind of a slide showing coronary artery obstruction, opening it up using a balloon catheter. So a balloon catheter is inserted into an artery of an arm or a leg and guided into that coronary artery. This is the atherosclerotic plaque that is reducing the diameter of this coronary artery. So the catheter is inserted, and then there's a little balloon that's inflated, and it stretches that wall of that artery, kind of squishes the atherosclerotic plaque, and opens up that artery. Quite often then they'll slide off a stent and leave the stent in that artery, which is shown over here. So that's one treatment. Another treatment is called CABG, or coronary artery bypass grafting. So what's done here is they'll take a blood vessel from another location. It's often a vein from the leg, and we'll talk about why that works when we get into blood vessels. But one reason is you have more veins than you have arteries. And these veins are all kind of helping to bring blood back to the heart, but you can actually remove sections of these veins. So this would have been a vein taken from the leg, grafted onto the aorta, and then grafted on the other side of the plaque. So here they show the plaque, so blood would be flowing this way. And what this grafted blood vessel does is bypass that blockage. And they can do this a few other ways. They can use a different artery to kind of attach there. They can use multiple pieces of veins and do multiple bypass. In severe cases, there might be a heart transplant. So heart transplants typically saved for end-stage heart failure. This is when there's really no other options. They've exhausted all other options. There's some other assist devices that could help the heart pump. But this is, pretty much the last resort. The patient's put on a heart-lung bypass machine. So temporarily oxygenates and circulates the blood while the heart is the old heart is removed and the new heart is placed inside. So here is the patient's heart missing. So they took off the old heart. They detached the vena cava. They detach the pulmonary trunk. They detach the aorta. A lot of times what they'll do is they'll leave kind of the back of the left atrium there, because it's pretty difficult to detach all four pulmonary veins. So they kind of leave this back wall of the left atrium. Then they'll cut a big hole in the new heart in that left atrium, and they'll kind of just drop it in. They'll resuture the vena cava, suture the aorta, suture the pulmonary trunk, and open up those great vessels, and quite often that heart will just start beating spontaneously again. No need for shocking it or anything like that. Once the blood starts flowing through those coronary arteries again, that heart muscle will start to beat spontaneously. So kind of an interesting thing. Obviously, it's the limiting factor are donor hearts. It's there's not a whole bunch of hearts available, so there's a whole procedure to get on the donor list. Hearts need to be regional. You can't get a heart from across the country because the stability of the heart outside of a human body is limited. One other thing to mention is patients that have heart transplants will have to be on immunosuppressant drugs for the rest of their lives. And that's to reduce the risk of having the immune system reject that organ. Okay, so that ends the anatomy portion of this chapter. So all the way up till now, it was largely anatomy and blood flow. So I kind of think of those as, one big part of this chapter. The next video, we're going to start to get into the physiology portion of the chapter. We start with what's called the cardiac conduction system, which is an actual path in which electrical signals, if you will, are transmitted through the heart, which is the heart's ability to coordinate its contractions. So it causes the atria to contract, then the ventricles to contract. So we'll pick up on that on the next video.